Mr Speaker.
I call Ian Lees-Galloway.
Thank you very much, Mr Speaker. I must say it is a pleasure to hear that the Health Committee is still operating in a constructive and mostly bipartisan approach. As someone who was a member of the committee for 6 years, I must say I miss that committee, and I understand that under the chairmanship of Simon O'Connor, it's doing very well. Well, Sarah Dowie, we've got an interesting select committee tomorrow, so we'll cross that bridge when we get to it. More interesting for you guys than it is for us, I must say. But it's good to hear that there's a convivial mood at the select committee, and it was good to hear how we can have a bipartisan approach to some of these health issues and how constructive it can be. And I'm pleased that the member who was speaking previously, Barbara Kuriger, was enthusiastic about the bipartisan approach, and a new member who delivered a very good 10-minute speech. Well done. Mr Speaker, this bill does a number of important things. A number of important things that I think, as some of my colleagues have pointed out, could have been introduced quite a long time ago if the legislation that included these aspects and others had been supported by the National Party back when Labor introduced them. So we could have been 7 years ahead of where we are right now if we'd had that same bipartisan and constructive approach back when National was in opposition. It's a shame, Mr Speaker, that we didn't have that same bipartisan and constructive approach. And this bill does a number of things which I know that the National Party has had some issue with in the past. It increases the range of infectious diseases that are notifiable. It improves the management of individuals with infectious diseases whose behaviour puts other people at risk of contracting a disease by providing new management options, including directions issued by a medical officer of health, court orders, urgent health risk orders and interventions. And it strengthens the legislative provisions for contact tracing of people who may have an infectious disease or may be exposed to one. Now, sir, all of those measures all require a degree of, of requiring a person to divulge information about themselves that may be uncomfortable for people to divulge some of that information, but it is really important for the public health, for our community, for our collective health, that those individuals are expected and now required under this legislation to offer up that information. The New Zealand National Party has not always been big fans of this approach, and I go back to the minority view expressed in the report back of the Public Health Bill, which was the Labor bill that was introduced by Annette King, that contained many of these provisions as well as others. And under a paragraph entitled Forced Disclosure of Health Information, the National Party had this to say: the bill, in requiring disclosure of information, creates a provision for non-government healthcare providers to mandatorily supply information to the Ministry of Health beyond what, if any, is already voluntarily provided. This has potential to create significant costs for these non-government providers, such as private hospitals, general practices and Māori health providers, and funders, such as health insurance, without reimbursement. For example, the cost to private hospitals of employing specialist coding staff to supply surgical data by purchase unit or diagnostic related group to the Ministry will not be insignificant. The Ministry advisors even acknowledge that it may take considerable time for providers to collate requested information. Providers and funders could be required to provide confidential financial and business information in the name of advancing health knowledge, health education and health research. It goes on. It goes on to talk about their concerns about people having to divulge information and health providers having to provide such information, the costs that would be related to that, and the impact on people's individual freedom to maintain that information. And so that was one of the somewhat spurious reasons on which the National Party based their opposition. And this isn't new. We've seen the National Party do this a number of times, where they see a political opportunity to make political attacks and to undermine a government, whether or not that actually is in the interest of advancing the well-being or the health of New Zealanders. And the fact that 7 years on, we're hearing from members about the wonderful bipartisan approach that has occurred at Select Committee, and the fact that these are all important measures to improve the public health, I think, sir, absolutely reveals the appalling political games that the National Party played with health when they were in opposition. It is just true. And there's some members who are newer members who are looking over at me, shaking their heads a little bit. Well, this might be a history lesson for them. They might not have been aware of this. But actually, time and time again, in the 6.5 years that I've been in Parliament, we have actually debated and passed, nearly unanimously in most cases, legislation that the National Party in opposition vehemently, loudly opposed because there was some group out there that they were trying to appeal to, or even if there wasn't a group out there that they were trying to appeal to, they just saw an opportunity to undermine the Labour government. That was all it was about, was trying to be... Sorry, say that again? Well, there you go. That's the level of debate. That's what Brett Hudson thinks is an important contribution to make to a debate about public health. He's wrong, of course. He obviously actually hasn't understood how the Labour Party works. But what we're talking about here, Brett Hudson, is we're talking about advancing the public health and well-being of New Zealanders, and the fact that the National Party plays politics. The fact that the National Party plays politics around these things. And it's great. It's fantastic that we're doing this. But look, actually the legislation, the Select Committee in its bipartisan and constructive approach has actually come back expecting that even more information will be devolved, including sex, date of birth, National Health Index number, all things which are going to be useful in terms of bringing under control notifiable infectious diseases and advancing the public health and well-being of New Zealand. But I just come back to the fact, Mr. Speaker, that we could have done this 7 years ago. We could have done this 7 years ago, but we know that the National Party, what do they do with all this stuff? They always play politics. Sir, I had a look, because I'm not on the Select Committee anymore, I had a look at the departmental reports, and I found that there were 2 departmental reports, one on infectious diseases, one on the issue around sunbeds, both of which were nearly 100 pages long. So there was obviously numerous submissions, and there was obviously a lot of evidence to go through. And it would appear that for the most part, the Select Committee in its bipartisan and constructive approach has taken an evidence-based approach to these issues, including the issues around the link between sunbeds and melanoma. And I noticed one of the reports that the Select Committee received noted that there was a strikingly high rate of university students who use suntan beds, and those would be university students, I assume, who are who are over 18, who are possibly in their early 20s, who are using these beds. And it is concerning that these young people are perhaps using these beds in an unregulated environment, not being fully aware of what the long-term impacts might be of using those beds. So look, so it is good to see that the Parliament is working together to do things which are constructive and which take a long-term view of health, which are about maintaining health and well-being to try and prevent disease further down the track, particularly around melanoma. And it's good to see that for the most part they seem to have followed the evidence. There is clearly there are some small differences of opinion between this side and the other side of the House around about how far they went in following the evidence. But sir, for the most part, this side of the House is very pleased to see the continuing passage of this legislation. We're just so disappointed that it's taken 7 long years for the National Party to finally see sense.